I started out with getting my bachelor's at Centenary College of Louisiana, Bachelor's of Science in Biology. I then went to medical school here at Louisiana State University and followed that with residency here at LSU in Internal Medicine and Pediatrics. I've always wanted to be a pediatrician, and somewhere along the lines in medical school, maybe between my third and fourth years, I started doing your clinical rotations, and I still loved internal medicine. I loved how you think about the body, how you study it, the disease processes. I love preventative medicine, but I've always had a love for the kids, so I just couldn't leave that behind. So when I found out about medicine and pediatrics, it was just the perfect mix for me, so I think that's how I got into it. I just want them to feel like they're at home. When I went to the doctor, I never, as many times as you go as a child, of course, you get vaccinations every time you go, but I didn't have that fear when I went. I knew my doctor, and I always wanted to implement that once I got out into practice. I think that's what I've always wanted. I want a medical home, and I like doing it for the family. Before I joined Willis-Knighton Internal Medicine and Pediatrics, I actually worked as a resident under the staff. So we've actually learned to work well together. I like it because you have the opportunity to work as a team. So sometimes there may be something that the other one's seen and we haven't, like a rash or a new process, like how would you have treated this in the past? So we kind of work well together. And so I think that's a nice fit. You kind of get to know all the doctors at the same time, even though you can have your own doctor that you would regularly see. It was a perfect fit. I haven't encountered an internal medicine and pediatrics office here yet in the city for me, and so everything was really outside of here. So it was the perfect environment and niche to practice that type of medicine, and without being just a hospitalist or working in just the pediatric clinic, I could have it all in one. It's kind of like you get everything all in one location. I can take care of anything from your firstborn up until your grandmother, and you can come all together. And I love the mix. There's never a dull moment in the day. You get to see a little baby, go see their mom later on, bring the kids later, dad later, and it's nice. So I think the mixture is just very unique that it's all in one.